Good evening, everyone. Today we'll be discussing some slides from dental histology, and this is the first slide that I've got for you. So in this slide, I hope you can easily identify the tissue that is on display, right? If you look towards the left side of this histological diagram, you would notice that it has the typical tubular structure, right, of dentin. As you can see, can you visualize these small dots everywhere, right? So this is the tubular structure of dentin. The tissue on the left is dentin, right? So what is this tissue? This is the cementum, right? The cementum which is bordering the covering the dentin on the root surface. So this is the cementum, and if you look properly, you can even visualize the incremental lines in cementum. Can you notice these incremental lines here? Can you notice these incremental lines, these fine incremental lines here? These are the incremental lines of Salter, right? When you look at this particular region, in this region, you will notice that there are no cells. So probably this is the acellular cementum. As you move towards the apex, you would see these fine black dots, right? You would see these black dots. So what do these black dots signify? These black dots are nothing but the cementocytes. That is, this layer is the, as we move towards the apex, we go into the cellular cementum. So towards the apex, there is a transition in the cellular cementum, and towards the coronal side, this is the acellular cementum. Are you guys present? Am I audible? तो यहां पर हमने क्या क्या देखा? अभी लेफ्ट साइड हमने क्या देखा? There is dentin, right? Or you can say portion of the root. Then there is cementum. Then there is acellular and cellular. You can divide the cementum into cellular cementum. The cementocytes in this region, isn't it? And there are no cementocytes here. What is the next tissue? Just adjacent to the cementum, you would see that this is the periodontal ligament. So, जैसा कि हम draw करते हैं line in our notebooks, period does not appear like that, isn't it? But what you would notice here is, let me zoom in. What you would notice is that there is dense collagen fiber here, and then there are fibroblasts associated to these collagen fibers, isn't it? On one side it has bone, and on the other side it has cementum. So that's how you can easily identify this tissue as periodontal ligament. Now take a look at the orientation. Of this PDL, this periodontal ligament bundle, isn't this collagen fiber bundle? Take a look at its orientation. Do you think it is going from a coronal bone to the apical tooth? Do you think that is happening? So can we classify it as one particular type of periodontal ligament fibers? So we also notice that there are so many fibroblasts associated with this tissue, isn't it? There are so many fibroblasts associated with the tissue. If you take a closer look at the screens, you will see small blue dots. So all these blue dots, they are nothing but the fibroblasts, isn't it? They are all fibroblasts. These fibroblasts are associated with PDL. This particular look can be classified as oblique growth, isn't it? Oblique fibers of the periodontal. Now when you move further left or further right, what do you see on the further left? This is the alveolar process, isn't it? This is the alveolar process. So alveolar process is made up of cortical bone, outer cortical, and the inner spongy bone, isn't it? So this is the outer cortical bone. When you say called the lamellar bone is deposited in layers. That's why lamellar name, isn't it? So layer by layer deposition of the bone. So you can see here that the structure of this bone is typically laminar. You can see these lines, isn't it? You can see these lines. So these lines represent the activity of the bone, and that's how we know that this is the lamellar bone. But as you move inward, as you move towards the spongy, as you move towards the bundle bone, you would see that there are Haversian systems, right? You would notice the Haversian canals. The bone appears spongy, isn't it? So this is in total the bundle bone as Sharpie's fibers are getting inserted into it, isn't it? So any bone where collagen fiber gets inserted into it is known as bundle bone. So this is the bundle bone. Outer layer is cortical, inner layer is cortical, right? And also you can see the spaces for symmetric, so it's easy to identify. क्या आप सभी को समझ में आ रहा है? ये हमारी आज की पहली स्लाइड है. This is the first slide for today, right? And the slide has PDL, it has dentin, cementum, and the alveolar bone, right? So let's move on to the next slide. I hope this slide is clear. I hope this slide is clear for you, right? So let's move to the next slide. So this is the next slide, and more or less it's the same tissue. Again we have a section of the tooth along with the PDL and the alveolar bone, right? But here, as you can notice, the structure of dentin is quite clearly visible, isn't it? You can easily see the dentin fibules here. So you can easily identify this is the dentin, right? And also you can easily find the incremental lines of Salter. Incremental lines of Salter. So you can easily identify the cementum here as well, isn't it? Again, this is the PDL, and here I guess you can very easily identify. You can very easily identify fibroblasts. Again here you can notice small blue dots which represent fibroblasts, right? So this is one bundle, another bundle. All these are periodontal ligament fibers, isn't it? And again, moving left, you can identify the alveoli, right? So both first and second diagrams are more or less same. So questions, they may ask you to identify one of the particular structures amongst these. They might ask you to identify the PDL group from this diagram. So in the first diagram here, you can clearly see the orientation of the fibers. In the second diagram, it may not be that clear, but here the orientation is very clear. So if the examiner asks you which group does this fiber belong to, you can easily identify that this belongs to the oblique group of fibers, isn't it? Here also you can identify this belongs to the oblique group of fibers. If you take a look at it, these fibers are running more or less in a oblique direction, isn't it? They are running more or less in an oblique direction. So these are oblique periodontal ligament fibers. So these first two are of the same tissue. So what is this tissue here? Let me help you with identifying these structures, and then maybe you can tell me what you are looking at, right? So let's start with this upper right part. So as you can see here, there are there is obviously a layer of epithelium. You can identify easily that there is a layer of thin epithelium here going covering this tissue on the surface, and beneath this epithelium on the right side upper, you can see here there are some structures, isn't it? So what are these? As you can see, there is some blackish tissue here inside of it, and it looks almost like a hair, isn't it? So what is it? It actually is a hair. It actually is hair follicle, isn't it? What are these? These are nothing but hair follicle. So what does it point you towards? It points us towards that this portion definitely has to be skin, isn't it? This portion definitely has to be skin, isn't it? Then what else do we identify here? We can easily identify some glands, some glandular structures are present, isn't it? Some glandular structures are present here. As you can see, these are all glandular structures. So glandular structures associated with skin, what can they be? Also, you have to notice that they are associated with the hair follicles. So most probably they are sebaceous glands, right? Most probably they are sebaceous glands. What happens next is that this tissue transforms. Let me further zoom it. So as you can see that this tissue further transitions into this epithelium. Can you notice there is a sudden transition at this point? There was skin here and then there is sudden transition. The rete ridges are now deeper, isn't it? The rete ridges are long and deep. As you can see, there are long and deep rete ridges, isn't it? Long and narrow. Long and narrow rete ridges, isn't it? So haven't we read somewhere that there is a transition from skin to mucosa, and in this transition the rete ridges become longer. That's why the mucosa appears pink in color, isn't it? And the epithelium also transitions from orthokeratinized to parakeratinized to non-keratinized, isn't it? So skin is orthokeratinized. From skin, this zone has become parakeratinized. This is all parakeratinized. It's all parakeratinized zone. Also, you can notice some glandular structures here, isn't it? You can notice some glandular structures here. So what are these glandular structures? Maybe we'll come back to it later when you have identified what this tissue is. So as we keep on moving, what notice is that this parakeratinized layer has now transitioned into a non-keratinized layer. Also, you can notice a glandular structure here, isn't it? You can also notice a glandular structure here. So maybe this is a mucus gland, isn't it? जैसा कि आप देख पा रहे हैं, it is not very clear because it's a big tissue. So zooming it in makes it a bit blurry, right? So zoom it out. Basically, this is a mucus gland. The mucus gland. So let's zoom out further. So what is happening here? Skin थी, right? So there was skin. We started off with skin, then parakeratinized layer, and then finally non-keratinized. So what is this tissue? This is nothing but lip, isn't it? What is it? It is lip. Or this border is the vermilion, isn't it? This is the vermilion, and this is the inner labium mucosa, isn't it? So this tissue shows the transition from skin to the labial mucosa. You can identify the mucus salivary gland, minor mucus salivary gland. Then you can easily identify the parakeratinized tissue, parakeratinized epithelium, and the orthokeratinized skin. क्या आप सबको समझ में आ रहा है? Are you guys able to understand? Are you guys able to follow? Are you guys able to follow? So what are these structures? What is this structure? It is seen throughout the lip, isn't it? What is this? This is nothing but the muscle. These are nothing but the muscles, right? So orbicularis oris, isn't it? This is the orbicularis oris muscle. So next I have again got a histological diagram of bone. So can you guys identify what type of bone is it? Is it intramembranous or is it endochondral? Is it intramembranous or is it endochondral bone? Can you identify this tissue? Can you identify the tissue? Is it intramembranous bone or is it endochondral? Which type of bone are you looking at on your screen? So for the head, take a look at this area. Take a look at this area. This looks like normal connective tissue, isn't it? This looks like normal connective tissue. There is no cartilage, isn't it? You cannot see any cartilage. This all dark tissue, all of this dark tissue, this is bone, isn't it? This is mature bone. and this lighter tissue, this is forming bone. So newly forming bone and mature bone. Both can be seen. Connective tissue can be seen. So what is an intramembranous bone? Intramembranous bone is when bone directly forms in the mesenchyme, isn't it? The mesenchymal tissue they condense, and then the osteoblasts differentiate. These osteoblasts will deposit osteoid and which will calcify to form the bone. So that's intramembranous bone, isn't it? So here there is no cartilage visible in the picture, only mesenchyme. So this is the mesenchyme. This is the mesenchyme. As you can see, there are just cells, isn't it? There are just cells. So these are the connective tissue cells, and hence this is the mesenchyme. And when you look at this bone, what you notice is that the newly forming bone is ripped by osteoblasts, active osteoblasts. Can you see these active osteoblasts? Can you see these active osteoblasts? Here. Can you see these active osteoblasts? There is a layer of dot, right? Blue dots. Can you see this layer of blue dots? It's giving this light pink tissue. Why? Because this is the newly forming bone, and those are the active osteoblasts. In these lacunae in the bone, naturally you can see the osteocytes. So that's how you identify the intramembranous bone. You have mesenchyme, then you have newly forming bone, right? There are osteoblasts within the newly forming bone. So newly forming bone is always lighter in color as compared to the mature bone or the calcified bone, right? No one is responding today. कोई है या नहीं है? आप लोगों को समझ में आ रहा है? ठीक है. So here I prepared a table to tell you about the different intramembranous and endochondral bones that are seen in the head and neck, in the face region, right? So mandible is a mixed bone, right? Mandible has both intramembranous and endochondral bones. So body and ramus, they are made up of intramembranous bone, while the condyle, it undergoes endochondral bone formation, isn't it? So it has cartilage. We know that it is lined by fibrocartilage, isn't it? So condyle develops by endochondral ossification, whereas the rest of the mandible develops by intramembranous ossification. Same goes for temporal and occipital. So these are the three bones which will show both intramembranous and endochondral ossification. Clear? So let's go to the next tissue. So this is a special stain, right? This is a special stain. अब ये stain कौन सा है? Sometimes they might ask you about different staining techniques, isn't it? जरूरी नहीं ना हर बार आपको H&E stain section ही दी. So this definitely does not look like H&E stain, isn't it? Magenta नहीं है H&E वाला. It looks more pink, isn't it? It looks more pink. So what is this stain? This is nothing but the Mallory's stain, right? This is the Mallory's stain. So Mallory's stain is used to stain the cytoplasm. It will stain pink, right? The collagen fibers, they will be stained blue, and RBCs will be stained orange. So it will stain the tissues in different colors. So that's how it helps in differentiating different tissues, right? जैसे कि आप यहाँ देख रहे हो, cytoplasm is all pink. Even the nucleus will appear red. The nucleus won't appear blue as in the H&E staining. Rather, it will appear almost red in the Mallory's stain. तो Mallory's stain का भी कहाँ पर कहते हैं collagen, जैसे मैंने कहा, it will appear blue. Muscle cytoplasm will appear red. Nuclei will also appear red, and RBCs will appear orange, right? So this is the special stain. So अगर इस तरीके का आता है आपका स्प्रिंग, तो you have to identify this stain. It is a Mallory's stain, and it is trichromatic. It has 3 types of dyes in it. That's how it helps in differentiating between different stains. So there is another trichromatic dye which is called Mason's trichrome. ये है आपका Mason's trichrome का stain. Right? So this is another tissue which has been stained with Mason's trichrome. Again, this is a special stain, and as you can notice here, you can properly differentiate different colors, isn't it? यहाँ पर blue भी दिख रहा है, red भी है. What is this blue? Blue is nothing but the collagen. Blue is collagen. And this red, it is epithelium. Also, here this red is the muscle. So muscle and epithelial cells, they are stained. Muscle and epithelial cells are stained in red, and the collagen is stained in blue, right? Now, if I would have zoomed it, you would notice that the nucleus appears almost black. The nucleus appears almost black, but I don't think we'll be able to appreciate it in this diagram. But इस तरीके का अगर डायग्राम आता है तो you should remember that this is nothing but the Mason's trichrome staining, right? Mason's trichrome. So as the name implies, again it has three types of dyes and it is used to differentiate between the different connective tissues, right? So Mason's trichrome dye, कुछ इस तरीके का. This is the another special staining technique, and this is known as Van Gieson. This is Van Gieson staining. So Van Gieson staining, what it does is it differentiates, but it will help you differentiate between again different connective tissues. Collagen is stained in red. So ये जितना भी red लिखा है, all the red is collagen, and then you'll be able to notice some black fibers, right? So if I zoom in, you'll be able to notice some black fibers. Can you notice these black fibers? Black fibers, these black fibers. These black fibers are nothing but elastic fibers. So it helps differentiate between the collagen fibers and elastic fibers. Also, you will notice that the muscle is also stained in red color. So muscles will be stained red in color. Collagen is stained black in color. As you can see, the nucleus here. Can you notice the nucleus? The nucleus is stained in black. Keratin, again, it is stained in black. And the cells, that is cytoplasm, it appears, you can say yellow to orange, isn't it? So the cytoplasm is stained yellow to orange. Keratin is stained in black in color. Nucleus also is stained black in color. Collagen is stained red in color, and elastic fibers are stained black in color. So that's how it will help you differentiate between different components of the tissue. I hope you are able to understand these different stains. If there is any doubt, you can feel free to ask me. So this is a general differentiation of these three stains. So collagen in one sense, as I just said, it will appear red. In Mason's trichrome, we have seen it appears blue. And in Mallory's also, it appears. Muscle fibers, here they will appear almost reddish to blue, and they will usually appear red everywhere. Right? So basically, they are used to study or used to identify the differences between the different components of a tissue we are studying. Next, this is the histological section of oral mucosa, right? So, can you identify the type of oral mucosa that we are showing in this screen? Is it orthokeratinized or parakeratinized or non-keratinized? So that is all you have to do. Then you identify the type of mucosa displayed on the screen here. Can you identify the type of oral mucosa that you see on your screen? Is it orthokeratinized, is it parakeratinized, or is it non-keratinized? Simple question. Can you identify any of them? No? So take a look here. Can you see these fibers? Can you see these fibers? Right? So this gives us an impression that they are parakeratinized. Why? Because there is nucleus in the superficial layer, isn't it? There is nucleus in the superficial layer, plus there are keratin filaments. Filaments. You can easily visualize these filaments, isn't it, on the superficial surface. So there is keratin and there is nucleus in the superficial surface. It definitely has to be parakeratinized, isn't it? It has to be parakeratinized. But then look at the rete ridges, isn't it? When you look at the rete ridges, what about the rete ridges? Don't they appear thick and short? Isn't it? They appear blunt, they appear thick, they appear short, isn't it? Also, if we move further left, there is some area where we don't see keratin, isn't it? Where we don't see keratin, it appears almost like non-keratinized epithelium. It appears almost like non-keratinized epithelium. So, take a look here, if you take a look at this segment, it appears almost like non-keratinized epithelium. This segment, it appears almost like non-keratinized epithelium. So most probably this parakeratinization is nothing but the adaptation to the occlusal load or the injury that this mucosa is undergoing. Maybe this is a component of cheek mucosa, and that's why some area is non-keratinized, some area is keratinized. Maybe some sort of trauma is going on this one. But whatever the case is, we can easily identify it as parakeratinized because we can see keratin filaments and we can also see the nucleus in the superficial layer. Is it clear? क्या आप सब आइडेंटिफाई कर पा रहे हो? जो मैं आपको बोल रहा हूं, are you guys able to identify these components? Can you see the keratin fibers here? यहाँ सब keratin fibers हैं, isn't it? And then there is a nucleus also in the superficial. So this helps us identify it as parakeratinized. Now, when you compare it to actual masticatory mucosa, that is orthokeratinized mucosa, what difference do you notice? इसको और थोड़ा zoom कर लेते हैं. So what difference do you notice? What difference do you notice? Here you can see that there is thick and short reticular, but here we have thin and long reticular, isn't it? So thin and long reticles, where are they seen? They are seen in the masticatory mucosa. So wherever masticatory mucosa is present, if we have long and thin reticles, it helps in better anchorage. Why? It helps in better anchorage. Whereas in the lining mucosa, we always have thick and short reticles. Why? Because they help with flexibility of the mucosa. Right? This is why they have flexibility of the mucosa. So lining mucosa is always flexible, and attached mucosa or the masticatory mucosa is always stiff. It does not yield, isn't it? When you zoom it in, you can easily identify the superficial orthokeratin. There is no nucleus. There is no nucleus, isn't it? There is no nucleus identified in the superficial or the top layer. So you can easily identify it as keratinized layer, isn't it? तो ये तो orthokeratinized layer with long and thin reticles for better anchorage. और पहले जो देखी हमने ये क्या है? This is the parakeratinized epithelium. Probably parakeratinization is because of trauma, right? That's why it has thick and short reticles, which is a proof that this is lining mucosa, isn't it? So this is the next tissue. Yes, this is the next tissue. Can you identify this tissue? Can you identify this tissue? If you take a look at the curve of this tissue, this is the natural curve of the tissue. So oral cavity में इस तरीके natural curve हमें hard tissue में this black portion, मतलब this black portion. Can we identify this black portion as bone? Isn't it? You can see this cancellous structure here, isn't it? This structure भी दिख रहा है हमें यहाँ पर. Again, there is bone here, and the bone abruptly stops here. And beyond that is the soft tissue part, isn't it? So can we identify this as palate? Right? It shows the proper curvature of palate. You can see the rugae, right? ये rugae area भी दिख रहा है. This is the rugae area, anterior rugae area. Anterior rugae area, and as you move posteriorly, the palate ends, and you have soft palate, isn't it? So hard palate and soft palate both are seen in this diagram, in the histological section. So as you can notice, as we move towards the soft palate, we will have more of salivary glands. So can we see salivary glands in this diagram? Can you see the salivary glands in this diagram? Can you identify salivary glands here? As we move posteriorly towards the soft palate, you can easily identify these minor salivary glands, isn't it? You can easily identify with minor salivary glands. And minor salivary glands, they are all absent in the anterior hard palate, isn't it? They are absent in the anterior hard palate. So there are no salivary glands in the anterior part. Is it clear? So let's go to the next diagram. We have another diagram from oral mucosa. ये lip, tongue का है. And what do you see here? What do you see here? This is the histological section of a circumvallate papilla. This is the histological section of circumvallate papilla. Circumvallate papilla. Right. So in the circumvallate papilla, we know that it appears almost like a mushroom shape. Right. So mushroom shaped है. Plus it has taste buds on its walls. Right. It is surrounded by a crypt. This is the crypt, isn't it? And it has taste buds on its wall. So these are the taste buds. These are the taste buds that are located on its wall. It has most numerous taste buds. सबसे maximum taste buds जो है वो हमें circumvallate papilla के पास ही दिखते हैं. Apart from that, it is also associated with minor salivary gland. So von Ebner's salivary gland, isn't it? Von Ebner's salivary gland. So can you identify? Can you locate this salivary gland here? Can you locate this? Can you identify the salivary gland here? You can easily visualize this structure, isn't it? And von Ebner's salivary gland, minor salivary gland, we have seen that it is serous, isn't it? It is serous. Unlike other minor salivary glands, this is not mucous salivary gland. This is serous salivary gland, and that is why you can see that the nucleus here are circular in shape, isn't it? Can you appreciate this circular nucleus here? See, these are all circular nucleus, isn't it? These are all circular nucleus, isn't it? And the cells here are filled with small dots as cyanogen granules, isn't it? It appears granular. The cell appears granular. So this is the minor salivary gland, von Ebner's gland, which is associated with circumvallate papilla, isn't it? And that's why it appears serous instead of being mucous. These glands will drain. If you look everywhere, they are everywhere. The von Ebner's gland, they are present everywhere. This is the another gland, this is another gland, right? These are all lobules of the glands, which you can easily identify in this section. In fact, apart from this papillae, all we see in the connective tissue are major these salivary glands. It's called glandular, isn't it? So let's move to the next tissue. So what do you see here? Again, we have a histological section of a tooth along with its PDL or, isn't it? So on the left, we have dentin, or you can say the section of the root. But as you can notice, cementum appears to be stripped from this root, isn't it? Cementum appears to be stripped. There is no cementum, isn't it? Cementum is absent. So where is the cementum? Cementum has actually been stripped and gone with the soft tissue, isn't it? It is stripped during decalcification. Cementum got stripped and it remains with the soft tissue. So this is this thin layer, right? This thin layer. This is cementum. This is cementum. So as you can notice, it has a darker color as compared to rest of the soft tissue. This is cementum. So cementum has been stripped off from the tissue. But can you notice some tissue adjacent to the cementum that appears a bit different from the rest of the soft tissue? Can you notice this soft tissue? This soft tissue which appears slightly different from the rest of the soft tissue. Can you tell me what this is? Can you tell me what this is? This is nothing but the attached gingiva, right? This is nothing but the attached gingiva, isn't it? So this is attaching onto the tooth, isn't it? So this is the attached gingiva. Again, it's more or less same as the first two diagrams where we have seen some so right. Next, we have the section of a carious tooth. This is a carious tooth. As you can notice, it has caries on both its cusps, isn't it? So it has caries on both its cusps. Because of that, there is degeneration in the pulp. It is pulp stone. There are several other pulp stones. Plus, you will also see periapical widening, isn't it? You will also notice periapical widening. Now I want to call it inflammation because there are no inflammatory cells. So when you zoom it in, you will notice that there are no inflammatory cells as of yet. So maybe this is just either this is periapical widening or initial stage of the periapical inflammation, or there is some problem with staining, but for some reason there are no inflammatory cells in this region, right? Normal fibroblasts are still seen, collagen fiber is seen, so everything else that appears normal is seen, but inflammatory cells are absent, isn't it? So what else do you notice here? Can you notice the interradicular fibers? These are interradicular fibers. Notice how they radiate from the interradicular towards the root, isn't it? Apart from that, you can also visualize the PDL on the lateral surface of the root. You can notice the oblique root, the oblique root, isn't it? And you can also notice the horizontal, that transseptal fibers, isn't it? All these fibers are visible in this section. क्या आप सबको समझ में आ रहा है? So such type of diagrams may be asked, right? Such type of diagrams may come in your exam. So what do you notice in this section? What unusual thing do you notice in this section? Something unusual. Is there something unusual in this section? Can you identify something and just one point, only one point, something unusual in this section? So when you zoom in and you take a look here at the text, you would notice that it has a very thick layer of cementum, isn't it? You can easily notice these incremental lines. So we can identify it as cementum, right? This is not dentin, it is cementum. There is no tubular structure. So it's cementum, right? So we can notice an unusually thick cemental outline at the apex. So this is an example of hypercementosis, right? Hypercementosis. So this tissue, what it is showing is hypercementosis, right? हमने पीछे बोला था कि जो भी अटैच्ड या केराटिनाइज्ड म्यूकोसा है, it has longer and thinner rete ridges as compared to the lining mucosa. You can notice that transition here. You can notice that transition, isn't it? The attached gingiva has longer rete as compared to the alveolar mucosa, isn't it? Again, I have one more section just to show you the transseptal fibers. So you can see there are transseptal fibers, plus here on this side you can see this epithelium which has no retipex, isn't it? It has no retipex. Similarly, on the right side also you have epithelium which has no retipex. So what is this epithelium without retipex? It is the junctional epithelium, right? It is the junctional epithelium, and just adjacent to it, you suddenly have an epithelium which has extremely long retipex. Extremely long retipex. So this portion of the epithelium which is extremely long retipex, this is the sulcular epithelium. This is the sulcular epithelium. This portion where the rate apex are actively happening, this is the junctional epithelium, right? तो अगेन दिस इज क्वाइट इजी टू आइडेंटिफाई. तो अगर पूछे तो भी हमें उसमें क्या देखना है, रेट एपेक्स है नहीं है, किस लेवल पे है, और ज्यादा लंबे हैं तो एट दी सर्कुलर पोर्शन, दैट इज सर्कुलर epithelium, isn't it? Remember, we studied in class about true and false pulp stones, right? True and false pulp stones. So how are the true pulp stones formed? True pulp stones are deposited by odontoblasts, isn't it? True pulp stones are deposited by odontoblasts. So odontoblasts, somehow they get differentiated within the pulp and they will start depositing dentin within the pulp. So when the odontoblasts start depositing dentin, they will always deposit with tubular structure, isn't it? And you can notice tubular structure in this tissue, isn't it? यहाँ पर ये तो dentin है ही, this is dentin. You can notice the tubular structure differently. This is root, and inside of it, this is pulp, isn't it? Has to be pulp. Soft tissue associated with dentin has to be pulp. Within the pulp, again we have a hard tissue. So what is it? It is nothing but the pulp stone, and this pulp stone has tubular structure, isn't it? So what is this? A true pulp stone, isn't it? What is this? This is a true pulp stone, isn't it? Because it has a tubular structure. So definitely it has been deposited by odontoblasts. So how do the odontoblasts get differentiated within the pulp? Either it is because of the inflammation, isn't it? There is because of the inflammation. So inflammation, let's say if there is scaling or something, so the inflammation will be from the coronal end, and another source is cell rest of molasses. They may migrate from apical foramen into the root canal. So in that case, true pulp stones would be seen in the radicular pulp. So if it is because of inflammation, then the true pulp stone would be seen in pulp chamber. But if it is because of HERS, then it would be seen in the radicular, right? So if the stimulus is inflammation, then true pulp stones are seen in coronal pulp, and if the stimulus is cell rest of molasses, then the true pulp stones are seen in radicular pulp, isn't it? So they will be seen in radicular. So based on their location, we can say what the stimulus has been. So that was the true pulp stone, and this is the false pulp stone. You can see the laminated structure of this false pulp stone. So there is no tubular structure, isn't it? There is no tubular structure, and you can see a layer by layer deposition. Can you see these concentric rings? Can you notice these concentric rings? Right? So this stone has formed by layer deposition of the calcified matter, right? So this is due to dystrophic calcification. This is an example of dystrophic calcification, right? This is the false pulp stone. False pulp stones can form anywhere, but they are commonly found in pulp chamber, right? They are commonly found in pulp. And true pulp stones also, as I've said, they can form anywhere. If it is inflammation, they will be found in coronal part, and if it is because of cell rest of molasses, they would be more commonly seen in the part, right? But amongst the two, where are they more commonly found? They are more commonly found in the root canal, right? True pulp stones are more commonly found in root canal, but pulp stones overall are found more commonly in coronal pulp. So this is the structure of a salivary gland. This is the structure of a salivary gland, and here you can notice a mix of serous and mucinous cells. Here you can notice a mix of serous and mucinous cells. So as you can notice, the ones that are lightly stained, they are lightly stained because of the presence of mucin. So mucin is the one that is stained lightly, and the zymogen granules, they take up stain and they stain more bright, isn't it? So all the tissue that appears bright is serous gland, is serous acini, and the acinis that appear light are mucus. So this is mucus. This is mucus acini. Then here all these bright pink are serous acini. Now the difference that you would notice here is that in the mucus acini, the nucleus is lying at the periphery. It is compressed. Can you see this nucleus here? This is compressed. Again, take a look at any nucleus of these lightly stained tissue and you would see that again, look here, the nucleus is at the periphery and it is compressed, isn't it? Take a look at any of these acinis and you would notice that the nucleus is compressed at the periphery, it is flattened, all of the cell is filled with this white or you can say light deposit. This is mucin, isn't it? In fact, individual cell boundary is also lost here. Individual cell boundary lost. Let me get a clearer diagram for you. Just So now you can see it clearly, right? Now you can see it clearly. So take a look at this mucus cell. Take a look at this mucus cell. Unfortunately, I can't draw right now. But take a look at the mucus cell. It is this one, right? It is this one. And you can see that the nuclei are compressed at the boundary, right? But compare it to these serous cells and you would notice that the nuclei are all rounded, isn't it? They are all round here within the cell, not compressed at the periphery. Here you can see a serous demilune, isn't it? This is a serous demilune which is capping the mucus cell, isn't it? So, are you able to identify the difference? You can see that these serous cells are all granular, but these mucus cells, they just appear filled with this light pink deposit, isn't it? And you can see these fine nuclei at the periphery, isn't it? So that's how differentiate between mucus and serous cells. And this is a typical glandular, isn't it? So let's go to the next slide. Again, this is a slide of salivary gland. But the colors here are different. So why are they different? What has been stained with? It is the pass staining, right? This is the special stain, pass stain, periodic acid shift staining. And this pass staining is used to stain the mucin to identify the glandular structure. It can easily help you identify the structure. So you can see that the mucin, which appeared light in the previous slide, is now appearing brighter, isn't it? All of this magenta, bright magenta color, this is mucin. This is mucin. And the stain used here is pass stain, isn't it? This is the pass stain. And pass stain, it specifically stains the mucin, making it more brighter, giving it a more magenta color. So whatever you see here, this bright color tissue, it is all mucinous or mucus acinis. These are all mucus acinis, right? You can see that the nuclei are compressed at the border and there is loss of individual cell. You cannot identify individual cell in this acini, isn't it? Now, rest of the tissue appears almost normal as if it has been stained with HND, right? It appears normal like any other HND stain, but the mucin, it appears bright, it appears magenta. So that's how you identify that this is the pass staining and not HNE stain. तो यहाँ पर सवाल आपसे ये पूछ सकते हैं कि स्टेन कौन सा यूज हुआ है? तो स्टेन कौन सा यूज हुआ है यहाँ पर? पास स्टेन. It is not your usual HNE stain. Right? So that's the question that might be asked for this slide, that identify the staining technique used for this tissue. So the staining technique that has been used for this tissue is pass staining. And the tissue that you can identify here is mucin. So you can easily identify the mucus cells. तो पास क्या करता है, ये सब चीजों को मजेंटा 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 स्टेन कर देता है, चाहे ग्लाइकोजन हो, बेसमेंट मेम्ब्रेन हो, फंगल सेल वॉल हो, न्यूरल म्यूसिन गॉब्लेट्स, everything it stains in magenta. So we have this another section, and this is the section again of a decalcified tooth, and it will show you different zones of pulp. So here you can identify different zones of pulp. So before we go into the pulp, we have a dark and a lighter section of the dentin. So what is the darker section and what is the lighter section? The darker section is the decalcified. Dentin. And the lighter section is pre-dentin. That it has never been calcified. This portion was never calcified. But this portion was calcified and we decalcified. The darker part tells you that it was decalcified section and the lighter part is the pre-dentin. So pre-dentin कितना होता है? Approximately 20 to 40 microns in thickness. So 40 microns in young tooth and 20 microns in older tooth. So just beneath dentin, what layer would you identify in the pulp? Just beneath dentin, what layer would you identify in the pulp? It would be odontoblastic zone. Isn't it? It would be odontoblastic zone. And just beneath odontoblastic zone, you will have a very thin layer of cell-free zone, isn't it? Very thin layer of cell-free zone, which we may not be appreciated in this section very easily, right? But beyond that is the cell-rich zone. So you can easily see that there are groups of fibroblasts here, and they are all plump. They appear all plump, isn't it? यहाँ पर spindle जैसे fibroblasts शायद आपको ना दिखेंगे. They are appearing round. They all appear round, isn't it? They all appear plump. So it tells us that this is a young. All the fibroblasts are plump. This tells us that this is a young tooth, right? So sometimes such diagrams may be asked, and one of these tissues may be marked, and they might ask you, what is this? So let's say if this is A, identify A. A is nothing but decalcified dentin. What is B? B is pre-dentin. It is uncalcified dentin. So there is a difference between decalcified and uncalcified dentin. It was never calcified. So pre-dentin तो कैसा है? Pre-dentin तो कैसा है? Uncalcified. And it is lighter in shade, isn't it? And the remainder dentin is decalcified and it is darker in shade, isn't it? So let's go to the next section. Again, we have a section of decalcified tooth. ये क्यों लाए हैं हम? And what do you see here? What do you see in this section? यहां ये मत कहना कि क्राउन है और ये रूट है, ठीक है? This is the cross section of the root. This is not a longitudinal section. This is the cross section of a root. This is one pulp canal and this is the another pulp canal. So that's two pulp canals, isn't it? That's two pulp canals. So after I have told you this much, can you identify this light pink tissue? Can you identify this light pink tissue? Can you identify this light? Can you identify this light tissue? That is encircling this entire pulp canal. Can you identify this light pink tissue which is encircling pulp canal? What is it? It is secondary dentin, isn't it? This is the secondary. So in this section, you can identify the secondary dentin as. So this pulp canal has been narrowed because of the deposition of secondary dentin, and it may or may not have been present here. In this section, the secondary dentin is lost from the another pulp canal, right? These are the two pulp canals. One clearly shows this deposition of secondary dentin. Next we have, can you identify this stage of tooth development? Can you identify this stage of tooth development? This is the advanced bell stage, isn't it? This is the advanced bell stage. तो यहाँ advanced bell stage में हमें क्या दिख रहा है? We can identify the formation of hard tissue, isn't it? We can identify the formation of hard tissue. So if you look at it closely, you will see that there hard tissue formation, isn't it? ये दोनों hard tissue formation हमें यहाँ देखने को मिल रहा है. Enamel has separated from dentin, and this is the dentin. So enamel and dentin both can be seen in this section. Enamel is separated from dentin, and as we have read several times that the enamel or dentin forms at the cusp and progresses towards the cervical margin. See the visualize here that the formation of hard tissue is thickest at the cusp, isn't it? This tissue is thickest at the cusp tip, and as you move cervically, you will see that there is no hard tissue at the base, at the cervical margin, isn't it? So the tissue formation, the hard tissue formation progresses from cusp tip to the ceiling plate, isn't it? From DEJ to the surface. Also, you will notice that the enamel organ, it has started to collapse at the here. The enamel organ has started to collapse at the cusp tip, isn't it? हम हमेशा कहते हैं कि as the differentiation of ameloblast progresses, the deposition of enamel takes place. So, do you think that ameloblasts would be present only at the incisal edge here, or the cusp tip if it is a posterior, or a canine, right? So, do you think ameloblasts would be present only at the cusp tips, and as we move downwards, these ameloblasts would transition into the inner enamel epithelial cells, isn't it? So these inner enamel epithelial cells are not yet differentiated into ameloblasts. They still appear cuboidal, isn't it? You can see here that these still appear cuboidal. These still appear cuboidal because enamel formation. The odontoblasts haven't yet differentiated. The ameloblasts also haven't yet differentiated, and the tissue formation hasn't yet started. But as you move forward, you would notice the appearance of odontoblasts, isn't it? They have started to appear, they have started to differentiate, and because of the differentiation, they have started depositing dentin, and that's how the ameloblasts have been differentiated. So you can notice a change in the morphology of the cells from cusp tip to the cervical margin. These inner enamel epithelial cells, here they appear tall, columnar. So they are ameloblasts, and as you move downwards, they appear more cuboidal, isn't it? As you move downwards, they appear more cuboidal. Similarly, you can notice there are no odontoblasts in this zone. But as we move upwards, odontoblasts appear, isn't it? Because dentin has formed till this portion, the odontoblasts are present. You can easily identify these tissue in this diagram, isn't it? You can also see the stellate reticulum cells, isn't it? Stellate reticulum cells are also seen. Can you identify the dental sac here? Can you identify the dental sac in this diagram? So, if we zoom it out, I hope you can easily identify the dental sac. The dental sac contains the blood vessels surrounding the developing tooth jaw, isn't it? Can you see these multiple blood vessels? Can you see these multiple blood vessels? This swelling connective tissue around the tooth. Can you see multiple blood vessels and sort of a swelling connective tissue around the tooth jaw? So these collagen fibers that are swirling around the tooth jaw and contain several blood vessels. This is nothing but the dental follicle, isn't it? This is nothing but the dental follicle. And the bone that is seen at the base, that is forming the crypt of this tooth, isn't it? This is the crypt. This bone, it is forming the crypt of the tooth, isn't it? Where the tooth is developing. So this is the tooth jaw, and this soft tissue surrounding tooth jaw, which appears like a swelling of collagen fibers. This is the dental sac, isn't it? I hope it is easy to identify. Again, we have one more section of advanced bell stage. This again is advanced stage. advanced bell stage, and you can again identify forming hard tissue. So enamel and dentin are identified at the cusp stage. तो ये पिछले वाले डायग्राम से पहले की स्टेज हो गई थोड़ी, right? Because there the hard tissue formation has progressed beyond the cusp, but here hard tissue formation is limited to the cusp. So again you can notice here, यहाँ और अच्छे से शायद आपको दिख सके, as you will see that the inner enamel epithelial cells are all cuboidal here, but as you move towards the cusp, you can see that they are starting to differentiate, and from cuboidal they have become tall columnar, isn't it? From cuboidal they have become tall columnar, isn't it? And you can easily identify odontoblasts here, but there is no odontoblasts in this region, isn't it? तो इस तरीके से आप टिश्यू को आइडेंटिफाई कर सकते हैं. This is all stellate reticulum cells, right? So let's go to the next diagram. So what is this stage? ये कौन सी स्टेज देख रही है tooth development में? This is the cap stage, isn't it? This is the cap stage of tooth development. You can easily identify the shape of the cap, isn't it? तो ये कैप की शेप हमें आराम से दिख रही है ना? तो दिस इज द कैप स्टेज ऑफ टूथ डेवलपमेंट. कैप स्टेज में क्या होता है? स्टिलेट रेटिकुलम सेल्स होते हैं, आउटर एनामल एपिथेलियल, एंड ऑल दीस थ्री सेल्स आर देयर, बट द स्ट्रैटम इंटरमीडियम इज एब्सेंट, इजंट इट? दिस इज द कैप स्टेज, एंड which cells are absent? Stratum intermedium. Stratum intermedium is yet to. Stratum intermedium starts to form in the bell stage, right? So they are still absent in the cap stage, right? And you can also identify the dental cells, isn't it? This is the dental papilla. The papilla, enamel organ, and the tissue surrounding it is the dental sac. This is the stage before the cap stage. You can see here that the primary epithelial band, this is the primary epithelial band, isn't it? This is the primary epithelial band, and primary epithelial band, it proliferates at the 6th and 7th week of life, isn't it? So at the 6th week, it would proliferate in the vestibular lamina, and at 7th week it proliferates and forms the dental lamina. So this dental lamina will then give rise to the bud. So the bud formation takes place from the dental lamina, which has proliferated from the primary epithelial band. So you can identify here the bud stage of the tooth development. And when you zoom in, you will notice that all these cells are polygonal, isn't it? All these cells are polyhedral, polygonal, or they are of the same shape. Right now, there is no morphodifferentiation, isn't it? All these cells appear same. All these cells appear same, that is, they are all polygonal or polygonal, right? So this is the bud stage. The bud stage. So that is all we have for today. I hope today's class was helpful and you got to learn something new. I don't know. कुछ इसमें समझ में आया? अगर किसी स्लाइड में कुछ पूछना है तो आप पूछ सकते हो. If you want to ask anything, you can ask me, or else we can. So I hope ये क्लास में सबको सब कुछ समझ में आ गया. चलो then, good night.